Welcome to the Portland VA Kidney Transplant Family Education class. Purpose of this class is to provide you with an overview of the kidney transplant process. We will cover the risks and benefits of transplant, medications, social support requirements, living donation options, and other important details that should help you understand the transplant process at our facility. This class has been broken into several smaller presentations to allow you to take a break between modules. A handout of this presentation is available on our website. Feel free to print this out and follow along. We recommend you take notes since there will be a quiz at the end of each module and a final test to share with your transplant coordinator. Let's start with a brief history of kidney transplant. This slide captures the beauty of our campus. The first successful kidney transplant was performed in 1954 by Dr. Joseph Murray in Boston. The Portland VA started offering kidney transplants in 2001. We were the third kidney transplant program within the VA system and remain the only VA center in the western United States to offer kidney transplants. At this recording, we are one of 8 VA transplant centers in the nation. We have performed more than 600 kidney transplants. It is important that you understand transplant is a treatment option, not a cure for your kidney disease. You will always have kidney disease, and transplant is not your only option. You have the right to change your mind or refuse transplant at any time. There are times where a transplant may not be in your best interest, just like the stop sign in this slide demonstrates. We want to make sure that we are setting you up for success with your new kidney. If you have an infection or cancer, you need your immune system to make you healthy. This is not the right time to get a transplant and start taking anti-rejection medications. If we are concerned that you will not survive surgery, we won't do the surgery. There are rare times that the surgeons cannot do the surgery because of a patient's anatomy. Some examples of this are when there is scar tissue from previous surgeries or severe blood vessel disease. People who are very obese may also be too complicated to do surgery on. If you suffer from addiction or mental health concerns such as psychosis, you will need to address those before you are ready for a kidney transplant. If you are not taking your medication or following medical recommendations, you will not be offered a kidney. We need to know that you can take care of yourself before you receive a kidney, since things will become more complicated after transplant. When we talk about the benefits of kidney transplant, please keep in mind that these are long-term benefits. The first year is busy and can be hard on you and your support person. After the first year, transplanted patients tend to do better than those who stay on the wait list. What we hear most often from patients who are a few years out from transplant is that their quality of life has improved. We want you to get back to doing what you were doing before your kidneys failed: school, work, volunteering, traveling, or growing a family. Your quantity of life after transplant depends on your age and health conditions at the time of transplant. For those who are under age 65, we hoped to double the length of time you would have had you stayed on dialysis. For those over the age of 65, transplant will mostly increase your quality of life more than your quantity of life. Fertility can also be impaired by kidney disease. If you are of childbearing age, you can have children after transplant, but we ask that you wait 1 year if you are a male and 2 years if you are a female. This is because one of the medications we use to keep your kidneys safe is known to cause birth defects. We will need to adjust your medications before you try to have a child. Now, let's talk about the common risks associated with a kidney transplant. The first year after transplant is when you are most likely to experience complications. The way we keep your transplant safe is by giving you medications that prevent your immune system from attacking the transplanted organ. These medications have many side effects. You will be on transplant medications as long as you have a transplanted organ inside of you. These medications have many side effects. You will learn more about the medications in a future module. Unfortunately, these medications reduce your ability to fight off infections and cancer cells. This puts you at a higher risk of developing infections and cancer. Rejection is when your body recognizes the transplanted organ as being foreign and tries to attack it. Most of the time we can reverse this, but not always, and it can lead to the loss of your transplant. Transplant medications increase the risk of heart problems. They can be very hard on the heart and vessels. Anytime you have surgery, there is a risk of surgical complications and a chance you will need to go back to the operating room a second time. This rarely occurs, but you should be aware that this can happen. There are also financial concerns that will be discussed in an upcoming module. Something you might not have considered is the amount of support you currently get from your dialysis unit. After transplant, you won't have them to rely on to help you navigate your health care. The Scientific Registry of Transplant Recipients, also known as SRTR, provides potential transplant candidates with information that can help you make an informed decision about transplant centers. Information is collected by the Organ Procurement and Transplant Network, OPTN, from transplant programs, organ procurement organizations, OPOs, and histocompatibility laboratories. These three organizations include the teams that obtain and transport the organ, the transplant center, and the specialized transplant labs we work with. Updated information is available twice a year and is usually available in January and July. Feel free to check out how Portland VA compares with other transplant centers. We are very proud to be among the top programs in the United States. The evaluation process for transplant is lengthy and involves a lot of tests and appointments. You may have already completed many of these requirements. We customize the evaluation for each candidate based on your needs. We do quite a bit of lab work, too. You may find that you are doing these items in a different order than others. The evaluation is to determine if you are a candidate for major surgery and the lifelong care of your donated kidney. During the evaluation, we are looking for potential complications and to fix them when possible to set you up for success. Once you have completed your testing and meet with our team, the Selection Conference Committee will determine if you are a candidate for transplant. We do this by reviewing your results, making a list of your specific risk factors, and then weighing your risks against the expected benefits of transplant. There are 3 different answers that can come out of this committee meeting. You can be declined, deferred, or accepted for transplant. As you can see by the scale in this picture, we will be weighing the risks and benefits of transplant for each candidate during the selection conference. You will receive a letter in the mail with the decision of the selection committee. We encourage you to share this information with your dialysis center. If you are accepted for transplant, your Portland Transplant Coordinator will call you to let you know and review your risk factors for transplant and what you need to do before we place you on the transplant waiting list. It is your responsibility to keep us informed of your progress of your to-do list. Do not assume that your healthcare team or dialysis team is doing this for you. We are all working together to get you to transplant, but you are the most important person on the team. We need to know that you are going to actively participate in your care. If you are declined, it means you are not a candidate for transplant. The decision to not offer you a kidney would be made if we think transplant is not in your best interest. We may be concerned that we would do more harm than good for you. If you are deferred, it means that the team was not able to make a decision based on the information we have. This often means that you need additional testing or preparation before the team can decide if you are a candidate or not. Like the clipboard in this slide suggests, there are several things that need to happen before we put you on the wait list. The decision letter we send you will include a list of things you need to do before we can add you to the waiting list. Once you have completed these requirements, you need to notify us. We will need a current blood sample. This blood will be stored at the transplant lab in Portland and used to compare with potential donors. Once we have the blood sample and any additional information we asked for, we will be able to place you on the wait list for a deceased donor kidney with the United Network of Organ Sharing, also referred to as UNOS. The UNOS waitlist includes all the people waiting for transplant throughout the United States, both veterans and civilians. Here is your chance to see how much you have learned. Please take a few moments to determine which of these statements are true and which are false. The answers to the last slide's questions are as follows. Kidney transplant is a cure. This answer is false, as kidney transplant is a treatment option, not a cure. It is up to me to let my transplant coordinator know when I complete my to-do list. This answer is true. Please don't depend on your home VA or your dialysis center to keep us informed. We expect to hear from you. We need to know you are going to be a good partner in your care with our team. If I decide not to take my medications or show up for dialysis, it will not affect whether I am offered a donor kidney. This answer is false. Past behavior helps us predict future behavior. A kidney transplant requires a lot of self-care to avoid rejection. You must do your part to ensure success. The pre-transplant process can be complicated and may look different for each person. This answer is true. We know this has been a long process. We are glad you are interested in a kidney transplant at the Portland VA. We are honored to be a part of your care team. You have now completed the first education module, which provides an introduction to kidney transplant. You're ready to go to Module 2 to learn about the science of matching donor kidneys to recipients.